I was referred for the 2-week referral. She said, I think you've already been told it was probably a cancer, and in fact it is. And she explained what type of cancer it was, and that I would need surgery.
Most surgical procedures, there is tremendous experience, both locally, nationally, internationally, about what surgical procedures can be safely delivered by surgeons, anaesthetists, healthcare workers in a day surgery setting.
Fasting is very important, and that's about your safety when you're having an anaesthetic. You may find that it's easier to fast from 12 midnight the night before if you're on a morning list. If you're coming in the afternoon, we potentially will allow you to have a light early morning breakfast, and that then makes it easier for people coming in later in the day and when they're fasting.
The theatre list is the order of the operations that's planned for the day. If you're first on the list, you should be here by 7 o'clock. However, if your surgery is prepared for later on in the afternoon, you might arrive later, for example 12 or 1 o'clock. You'll be greeted by our admin staff who will go over your personal details with you.
We will be verifying your date of birth, your first line of the address, as well as your GP practice. And then we will make sure that you are the exact candidate which we need to do the admission.
People ask me my name, age, date of birth all the time. So I felt safe. I felt as far as possible they had taken every precaution to make sure that they'd got the right patient.
You're allowed to bring one person with you. However, please be aware that you are allocated to a room specific to certain genders.
We actively encourage somebody to come into hospital with you. You might be in the day surgery for a couple of hours before your surgical procedure, then having some company is obviously a great advantage.
We do advise for you to bring one small overnight bag with you, which should include your dressing gown, slippers, and any necessary medication or toiletries. We bring the patients in, you guys in, and then we double check your wristbands and reconfirm all your details and get each wristband on.
For most patients, we will have to do a urine test on admission. That is pretty standard for all patients. Generally, we do not have to take any more bloods because the bloods that were taken in the pre-operative assessment, we will be able to access those results. We will do things like your blood pressure monitoring, we will take your temperature, we will do weight, height, because that helps us with calculations of drugs. So fairly straightforward testing. We would encourage people to let us know if there has been any changes in medications, or if on the day or in the last 24 hours, maybe they've had something that is making them feel unwell.
So all first patients are asked to change into their gowns immediately. However, if you are second or third on the list, the nurses or CSWs will come around and let you know when to do so.
If you are later in the list, you can remain in your outdoor clothing until a time that is more appropriate. Most people don't want to sit around in a gown, so we try to minimize that time if we can. You will also need to put on some white stockings, which help to prevent clots.
They were wonderful, actually. They were great, they were kind, great. Helped me put the stockings on because they're quite tight. And obviously the gown, just general chatted, very pleasant. Yeah, they were good.
You will be seen by the consultant surgeon, and they will explain the surgery, explain the complications of that surgery and the outcomes and the plan.
I think Ms. Miskatani came first and explained about the operation and the complications that there might be.
I will come and see you before your operation, make sure all the checks are done. We will go through case history again. We'll take a history, we'll talk about the procedure itself, we will do what we call informed consent. This process will start in the clinic, but will end just before your operation in a formal way. You have to sign at the end that you understand all the aspects and all the details, and this is very important to be done, and the signature should happen before your operation.
And you would equally have a consenting process with the anaesthetist too, so that they explain the risks of an anaesthetic. And we would try to give patient information leaflets as well, maybe about your post-operative care.
The day surgery is such a key moment for you to meet your anaesthetist and listen to the anaesthetic plan. Make sure that you are happy and that you give your anaesthetist your informed consent to proceed to surgery under the anaesthetic technique that they explain. The consent process is going to be heavily based on what you understand, what has been taught to you previously, particularly at your pre-assessment appointment. This is the perfect time for you to volunteer any anxiety, any concerns, any questions that you may have about anesthesia. Please feel empowered to ask him or her any questions that you may have, because ultimately this is the time for you and your anaesthetist to start planning your anesthetic journey.
Few factors can influence whether you go ahead with the procedure on the day of the surgery or not, including if you do not follow the instructions, the pre-op instructions, like stopping some medications, mainly blood thinners, or not fasting. At the same time, we do what we call case review. So we will re-evaluate your condition. If there's any change in your medical fitness for the procedures, this may potentially lead to case cancellation on the day.
In the morning time, we may bring in 2 to 3 patients from one operating list. If there are some delays, one of those patients may have to wait for a couple of hours or so. We do try to keep the time waiting to a minimum where we can.
We do have Wi-Fi here, so you can bring a phone in or an iPad. Perhaps a book might be helpful, anything that may help entertain you.
I was perfectly happy. I didn't feel anxious. I sent little messages to people saying, here I am, here am I, my bed socks, you know, all that sort of stuff. I'm doing fine, I'm still waiting to go down, whatever it was. So that was comforting. I mean, in the old days, that wouldn't have been possible.
You often then are brought to the anaesthetic room by one of the members of staff from the day surgery unit, which would be one of the nurses or a healthcare assistant. And they often, if you can, walk you down to the theatre suite, which is a 1 to 2 minute walk from the day surgery unit.
All your belongings will be locked away safely in our lockers, and we do have a system in place where you do get your belongings later on, and if you go to an overnight ward, you get your belongings transferred to you over there.
It's a fantastic unit. We are blessed with dedicated multidisciplinary team, administrators, healthcare assistants, nurses, anaesthetists, surgeons, who are absolutely focused on getting you through your surgical procedure as safely, as timely, and as compassionately as we can. And I'm sure you will be very well looked after.
You've got a great team looking after you, so you'll be in good hands, and everyone will be checking in on you to make sure you're okay, and you can just press the buzzer and ask for anything at any moment.
The one thing I would encourage anyone is, if they do have questions or concerns, please do seek out a member of staff to ask that question. Don't allow the question to just sit unanswered.
I'm agreeably surprised by the whole procedure. It was honestly, it was like clockwork.